Good afternoon and welcome to the webinar. The topic of today's discussion is the long-term impact of the COVID-19 pandemic on vulnerable women and young children. My name is Zainab Bakit and I'm a research associate for the Child Health Policy Program here at the Baker Institute. I will be the moderator for today's discussion. Our speaker for today is Dr. Quianta Moore. Dr. Moore is a fellow in Child Health Policy at the Baker Institute. Her research focuses on using data to inform policies that improve the lives of children and the communities in which they live. Her primary area of expertise is early childhood development, and she has a broad research portfolio ranging from community and school needs assessments to legal and policy analysis. She is also the head of the Child Health Policy Program at the Baker Institute. Dr. Moore received an MD from Baylor College of Medicine, a JD from the University of Houston Law Center, and a Bachelor's of Arts in Sociology from Cornell University. Now for some housekeeping items. The webinar will begin with a short presentation followed by a live Q&A session. At the bottom of your screen, you will see a small chat button. The chat function will be available throughout the webinar. If you're interested in asking questions for the live Q&A, please send them through the chat window and your question will come directly to me. I'll then select a few questions to ask during the Q&A. All right, I hope you enjoy the webinar. I will now turn it over to Dr. Moore.
Thank you, Zainab, and thank all of you for taking some time out of your afternoon to learn about something that is really important to us here at the Baker Institute in the Children's Health Program. Today I'm going to talk about, and I will share my screen now so that you can see the presentation. Today I'm going to talk about the impact of the coronavirus on low-income women with children. During the webinar, I'm going to give you a synopsis of women in the workforce and COVID-19's impact on the labor market. I'm going to discuss the very unique impact that this pandemic has had on children, review recent coronavirus legislation, provide some recommendations, and then we'll open it up for your questions. So the current state of affairs. So as many of you know, because of the constant news cycle that we've all been listening to over the last several months, the majority of states have issued some version of a stay-at-home order, all creating exceptions for healthcare and grocery stores. The industries that are now essential are the ones that employ a large number of low-wage workers who are primarily women. Businesses that have been deemed as non-essential are continuing either operations remotely, as we are at the Baker Institute, or they've unfortunately had to close their doors, resulting in massive unemployment. In 2018, there were about 72% of US women who had children under the age of 18 who were in the breadwinner households. A breadwinner is defined as either a single mother who is the head of her household, regardless of the earnings, or a married woman who makes 40% of the couple's joint earnings. So looking at this graph by the Institute for Women's Policy Research, you can see that almost half of US women who are working, who have children younger than the age of 18 are breadwinners. And so when you look at the numbers in parentheses, that's the number of children who are in these households. So for instance, for Caucasians, 45% of Caucasian women are either single women or married and make more than 40% of their household income. And in their household, approximately 8 million children live there. So the coronavirus has had a very, I would say, special impact on low-income women, even though there's really nothing special about it. But essential employees or grocery store employees or low-wage healthcare workers, such as medical assistants and LVNs or licensed vocational nurses, the folks who have been deemed essential workers are going to be able to continue to make their low wages. But they're now going to have unique challenges in this pandemic. So for instance, childcare for young children. So childcare centers are closing at a very drastic rate, and I'll talk more about that later today. But now they're having to worry about additional childcare concerns, or if family members who may have been elderly, their grandparents, were watching the kids, now there's concerns about the children impacting this very high-risk population, and so that's no longer an option for them. Then, as many of us know, including myself and many of you, children are now out of school. And so trying to balance being able to go to work and figure out what you're going to do and what childcare arrangements you're going to make for your school-age children is something unique. There's going to be increased food expenses. So if children at home, families are at home, they're eating more. And so the expense of food is going up. The electric bill is going up, the water bill is going up. And so for many low-income families who are already living on the margins, now there's expenses that are going up. And then, as we've been hearing in the media, essential employees are now on the front lines. And so the increased risk of contracting the coronavirus has increased as well for these employees. Now, there's other low-income women who unfortunately are not going to work, or not able to go to work because their employer has been deemed as a non-essential business. And so those are the retail shops, housekeeping, some of the restaurants, temporary work. And for them, they're having a significant reduction in income as a breadwinner. And from that, there's going to be increased stress and anxiety from social isolation. So research done by Hall, and I'll provide some references at the end for your ability to be able to read on your own. But this study found that when single moms were unemployed, they were much more likely to be depressed if they were in social isolation. And so now we have a situation where all of us are experiencing a new social isolation. And so we anticipate that stress and anxiety is going to go up. And then loss of health insurance. So for many families, their health insurance comes to their employer. And now with the massive unemployment, they're no longer going to have access to health insurance. And a time when really being able to access healthcare is critically important. So let's talk about, how does this impact young children? There's a critical window of time in development during the first couple years of life. And this is true for all of us, regardless of the families we came from, our race, or gender. The human biology is that in the first couple years of life, our brain is developing at an incredibly fast rate. And what's happening here, as you can see in this graph, is that this is showing the neuronal connections for different functions. And you see here that the vision pathway and hearing actually happens very quickly. So in the first month or so of life. Those of you who have children may recall that when you had your newborn and you brought them home, you may have thought that they could see you, but in reality, all they could see was a gray blob. And that's because those pathways in the brain hadn't been completely formed yet. You see here in the first year of life, exponential neuronal connections are being made for language and speech. And then the higher cognitive functions, the first year of life, again, you see a very rapid, accelerated incline. And then over time, the next 14, 15 years, you see the rate starts to decline. So this period of time is really important because what happens really shapes and strengthens and determines whether or not that brain architecture is going to be strong and healthy, or if it's going to have weaknesses. It's similar to the foundation in your house. If whoever laid your foundation did a really good job and it's very strong, then you're not going to see problems later in life as far as cracked tile and cracks in the ceiling. But if they didn't do such a great job, then, as many of you or many of us have experienced before, when the foundation starts to shift and have problems, that leaves huge gaping holes in our ceilings, our walls, our tiles, and creates a lot of additional problems. Well, the brain is similar in that way. And so here you have a CT scan, and this is an extreme situation. So I don't want you to think that this is something that happens if a day goes by and a child is not stimulated or engaged with. But we're talking about children who had sensory neglect, meaning they were fed, they were taken care of, basic needs provided for, but they were simply ignored. They weren't nurtured or loved or stimulated in a very important way. And so you see here the size of the 3-year-old brain is much larger than the size of the child who was neglected. And that's because when neurons aren't stimulated, they die, they're eliminated. So what's our risk of abnormal brain development during this pandemic? Well, literature and decades of research have shown that the parental or caregiver interactions, that's what drives brain development. So either it's going to be positive or it's going to be negative. Parental stress increases the risk of adverse parent-child interactions. So in order to have optimal brain development, you need positive parent-child interactions. You need parents to be responsive to children when they draw a picture or a painting, or they cry because they're hungry or they're wet or they're sad. There has to be some response. The Center for Developing Child at Harvard calls that serve and return, an analogy of a tennis match. So those of you who have watched tennis can sort of imagine this ball going back and forth and these interactions happening between the caregiver and child. And those interactions are what drives and stimulates their neurons to connect in either a healthy way or an abnormal way. And so under extreme financial stress and even in natural disasters, parents are more likely to perceive their child's behavior as negative. And so if I am stressed out, if I'm concerned about being able to provide food for my family, or what's going to happen if I am a frontline worker and I get COVID-19, what's going to happen to my children or my family, then when my child does something small, the way that my brain perceives that is going to be more negative, and I'm going to be more likely to discipline them in a harsh way. Parental stress also makes parents less likely to cope with just parenting related difficulties. As I mentioned earlier, now children are out of school or childcare centers have closed and young children are at home. And so something that will be a normal thing, like fixing breakfast or lunch or playing or being asked questions, the normal day-to-day life or role of being a parent, it makes it more difficult to cope with those daily functions when parents are stressed. And there's increased parental depression, as I mentioned earlier, particularly in low-income single mothers. There's been a ton of research on natural disasters. The COVID-19 pandemic does qualify as a natural disaster, even though it's not the type of natural disaster that we've ever experienced before. But it does increase the risk of abuse. And so research has found that inflicted traumatic brain injury in young children increases after natural disasters, both intentional and unintentional. Now, in this situation, we probably won't see a lot of unintentional because we're not worried about trees falling or houses coming in or trying to make it through a flood where children can be injured or harmed in the disaster. But here we have a different type of disaster or a different type of traumatic brain injury that we're worried about. So the implications of this is that when the brain doesn't develop the way that it's supposed to those first couple years of life, children have lower IQ, it's more difficulty to learn, they have decreased vocabulary and impaired language, they have impaired mental and emotional health, cognitive delays, difficulty with self-control, and difficulty maintaining relationships. This is because the brain is responsible for everything, every aspect of our daily life, the brain is responsible for. And so again, that analogy of the foundation, if the foundation is not built properly, then over the lifespan, the children who then become adolescents, who then become adults, are going to have difficulties or challenges along the way. Now, unfortunately, the impact of COVID-19 is not just for young children. School-age children are also going to face significant challenges during this time. You see, schools for many children were on the front line for them. Teachers and counselors and principals were often the first ones to recognize signs of abuse, neglect, or maltreatment. They're also the ones to recognize food insecurity or other social needs and be able to connect families to very important resources. They also identify behavioral and learning problems early on, because early intervention is always much better, much more cost effective, as well as much more effective in achieving the intended outcomes when you intervene early. But now that schools are closed, that frontline advocacy and support for children is no longer there. And the brain is still maturing, even though I just said that during those first years of life, the foundation is being built. But then over a lifespan, the rest of that house is being built. And so the brain is still maturing, and certain parts of the brain that are particularly important for learning, such as the hippocampus, always forms new connections. That's how we learn or have memories, because of those new connections. But the brain is a use it or lose it type organ. And so if you don't use it, you lose it, which is why there's been research demonstrating that there's loss of reading and math gains during even the summertime. So in that short 2.5 month period of time, already there's gains lost in the summer for many children. And education is so important in this country for breaking generational poverty and for giving families and children an opportunity at upward economic mobility. So long-term outcomes that we can anticipate without intervention: there's going to be mental health problems, physical health problems, likely behavioral health problems. I put incarceration here because we know from data that prisons are built based on third grade reading levels. And so if we're thinking about a half a year of school lost, or children being in adverse family or social circumstances that put them behind emotionally, then we can anticipate that there's going to be delays. And because our system doesn't give the same grace and mercy for all children, that means that certain children, when they act out or they don't behave well, are going to be more likely to have the police called on them and more likely to be arrested or put in juvenile detention. We know that unemployment rates are going up, and for those children who will be growing up during this time, or who are in families that will have long-term and financial negative impacts from this pandemic, we know that for them, they may repeat that cycle of generational poverty and have unemployment and decreased educational attainment. So there's been lots of talk at the federal level about what to do. And there's a recent bill passed called the Families First Coronavirus Response Act, which was really the first bill that was passed that was directed trying to mitigate some of these challenges on families. This law was signed on March 18th. It went into effect on April 2nd, and then its effectiveness will end on December 31st, 2020. There's 3 provisions of this act that are most relevant to our conversation today. That's the emergency paid sick leave. They expanded the Family and Medical Leave Act, and then it provided additional funds for the Special Supplemental Nutrition Program for Women, Infants, and Children, otherwise known as WEC. Now, there were some exemptions or exceptions for this law applying to everyone. So the bill excluded businesses with 5 or 100 or more employees, and businesses who have 50 employees or less are able to also ask for an exemption. The healthcare industry was also excluded, and recent analysis of the law has clarified that, so that the exclusion is not mandatory. So hospitals and other healthcare organizations can decide to follow the guidance of this act, but so their exclusion is not mandatory, but we think it's going to still have a significant impact on low-income women, as you'll see soon. So the emergency paid sick leave. So let's just talk for a minute about why we would need emergency paid sick leave. Well, most federal level statistics show that low-wage workers are not offered paid sick leave through their jobs. So the federal government needed to step in to say, hey, employer, we are going to provide this for the employees. We will reimburse you for this through a tax credit if you will provide your workers with this paid sick leave. Because in a public health crisis, you don't want people having to make a decision between coming to work sick or being able to provide their families. And so this act was intended to solve that problem. It provides 2 weeks of paid sick leave at the employee's regular rate if the employee gets sick. It also provides 2 weeks of paid sick leave at 2/3 the employee's regular rate if the employee is unable to work because they can't find childcare. Because now, again, as I mentioned, for families that have children, we need to figure out how are we going to be able to manage our daily responsibilities of working as well as our children. The bill also expanded the Family and Medical Leave Act. And this provides, so in addition to the 2 weeks that someone would get, they would get an additional 10 weeks of paid expanded Family and Medical Leave of leave. And this would pay 2/3 of the employee's regular rate. So again, this is at a 2/3, so the employee would essentially be taking a 1/3 pay cut. And for this, employees only have to be employed for 30 calendar days, which is great, which is a new change to this, the FMLA Act. And they're allowing families who, again, can't find childcare for their very young children, or they have school-aged children, and they need to be able to provide care for them. And as I mentioned, this bill really reimburses the employer through tax credits. I want to note here that, as I've mentioned throughout our discussion thus far, childcare centers are becoming very critical. If I'm an essential employee and I have to go to work and I have very young children, I'm going to need someone to take care of my children in order for me to be able to go to the grocery store or to be able to go into the hospital. But unfortunately, childcare centers are closing at an alarming rate. The National Association for the Education of Young Children estimated that 30% of childcare centers say they can't survive a closure of more than 2 weeks, and almost 1 in 5 can't survive a closure of any time. Now, this statement was made prior to the coronavirus pandemic. And so what we're seeing now, and this data is as of today, April 9th, for Harris County as an example, there were 2,354 childcare centers that were open and available to take clients as of March 25th. As of today, April 9th, there's only 1,742 available. So that's an approximately 26% decline in a very short period of time. And so if we have workers who aren't able to take advantage of the FMLA Act or the Sick Leave Act, because they can't find childcare because their childcare center has closed, but yet they work for an employer who has 500 or more employees, or they're a healthcare worker. So basically the grocery stores, if you look at the data, most of them employ more than 500 employees. And so that means that for most grocery stores, they're exempt from having to provide paid sick leave or extended leave, the 10 weeks of paid leave if a worker can't find childcare because their childcare center has closed, or in the healthcare field. So in the low-wage workers, the MAs, the LVNs, they won't also be able to qualify for this. Now, very briefly, I'll talk about this supplemental nutrition for WIC. Now, this bill authorized an additional $500 million for moms who are either pregnant women or they have young children. So WIC qualifies is from birth to age 5 who lose their jobs due to COVID-19. So these would likely be those non-essential worker categories that we talked about earlier. But the limitations of this, or the effectiveness of this, is really limited by WIC was already having declining enrollment. The numbers for WIC participation had already been declining, even with the existing population of folks who qualify, in part because of some of the fears around whether or not receiving WIC benefits would exclude someone from citizenship or being able to be in the country, as well as a variety of other factors. Also, in reality, the benefit is very small. So it's about $41 extra, plus they get formula. And so when you think about, again, the conditions that we're talking about, while it may be a help, it's not going to be a huge impact on these families. So what do we do? Well, the next coronavirus legislation really needs to include the following. We need to close the gaps in paid sick leave in the Family Medical Leave Act. As I've mentioned, when you think about low-wage workers and you think about where low-income women who are likely, over half are going to be breadwinners, particularly if they were in one of the minority categories in that graph, then they're working in large part at grocery stores and in the healthcare industry. And so if you've now excluded them to be able to take advantage of that, then you mean that you have mothers making a decision either between, going to work so they can feed their family or staying home because they feel ill and they don't want to, spread the virus. And that's not a position that anyone should really be in. And really explicitly almost, this piece of legislation was intended to avoid people from having to make that decision. And so the gaps really need to be closed so that folks, everyone, particularly those essential workers, have an opportunity for paid sick leave and to take advantage of the Family Medical Leave Act. We also need additional financial support for childcare centers. As I mentioned, they are closing at an alarming rate, and that's because most childcare centers, their profit margin was already very slim. And so even being closed for a week means that they're closing their doors. And so we need additional support for them in order for them to be able to provide care for the children of essential workers, but also for parents to have a chance to take a break, particularly those that we think are at risk of child abuse or maltreatment from being at home for long periods of time. There's also some opportunities for the philanthropic community. So, I didn't have an opportunity to talk a lot about this today. This was really intended to be an overview because each one of these slides, I probably could have talked an hour about each of them. But for nonprofits who are providing parenting support to low-income families, they need additional support to be able to transition from the in-person support that they were providing to a virtual support, kind of like what we're doing here today. We need innovation, we need creativity about how to reduce the social isolation that's happening right now for at-risk families. We need to be able, again, with schools being closed, to find ways to check in on families, to be able to recognize when there's needs in families and recognize for really the silent population of children who really don't have access to the same sort of agency and resources to be able to make sure their needs are met. They're really dependent on their caregiver. And so, philanthropy really has an opportunity to bolster this sector in order to prevent child abuse and maltreatment during this time. So thank you all for listening today, and I'm looking forward. I see that we already have a lot of questions coming up, and so I'm excited to hear from you and hopefully be able to answer your questions. I did want to give a special acknowledgement to my colleague Joyce Beebe, who is a fellow in public finance. As you probably guessed from my bio, I am not a labor market expert, and so she gave me a lot of statistics that I was able to present to you today. We also co-authored an issue brief about this topic, and so if you're interested in learning more or getting additional references, our issue brief is found on the Baker Institute website, and you can feel free to read that. And then a special thank you to the moderator, Zainab, who will be taking your questions, and I'm going to turn it over to her now.
All right, thank you for the presentation. The first question is about the local work Harris County is doing to provide childcare for essential workers. So if you could comment on that.
So I'm aware of the city of Houston. I know there was a press release for the city of Houston providing childcare for their essential workers. And so I'm learning right now that Harris County is doing a similar thing. The percentage of folks who are essential workers who either work for the county, like those would be your first responders, your EMS, those folks are not the same population that I'm talking about here. So I think it's great that they're providing childcare for the frontline workers and the essential workers, but many of them are not women. The firefighters, the police department, and they the percentage of them in the general population is much smaller than the grocery store workers and childcare workers and healthcare workers who are not employed by the city or the county.
Thank you. There is also a question about fears related to dropping children off at childcare centers, considering that many children now will need care if their parents are essential workers, and the stress that perhaps childcare staff may be experiencing.
Yeah, I think that is always a concern. One of the things that I didn't have an opportunity to talk about today is really that childcare workers really are part of the low wage working force. And so for them, childcare workers are usually women, are usually paid very low, so they're part of the low wage workers. And then they're expected to have the capacity and bandwidth to provide this social emotional support for not just their children, but a lot of children. And so I think part of the efforts of bolstering up and supporting childcare workers is in increasing their wages and providing mental health and additional supports for them so that they can be at their best to coming to work. There's also the social distancing guidelines, and that's something that's a challenge. And the reason why the schools are closed is that we absolutely need childcare, but then there's the issue of, well, how do you have a lot of children in close proximity to one another in a facility? Some childcare centers or facilities take temperatures before they go in. They have they screen the kids before they enter them. And so I think that, they try to do whatever public health measures they can to reduce the spread of the coronavirus, but it's definitely a challenge.
Thank you. We have another question about the role of government and philanthropy. So the question is, in bad times, philanthropy typically fails or struggles due to donors having less money. Do you think there's a role for government to help when funding dries up from private donors to these critical nonprofits, or rather better planning done by the nonprofit organizations?
Yeah, so I absolutely think there's a role for the federal government. I think there's always a role for the federal government. The reason why I put it under philanthropy is because generally the government is not as responsive and as quick to respond to things like, the nonprofit sector drying up, or not being able to respond immediately to situations that are arising in communities. And so there's obviously a role in government, but government right now, I think, is so busy concerned about how do we slow the spread of this disease? How do we get our healthcare workers with the protective equipment that they need? How do we support and fund innovative research to be able to develop vaccines and other treatments for the disease? And how do we prevent our economy from completely falling apart? And so I think from a priority perspective, the federal government right now is not going to be thinking about, how do we support low-income women through or parenting support through the nonprofits.
Okay, thank you. And we have a question about whether there's a donation fund available to help childcare and early childhood development centers in Harris County and Fort Bend, or if there are other organizations that can support with this kind of work.
So I'm not sure if there is a donation. I know that the Greater Houston Community Foundation has partnered with several other philanthropic organizations. And I think they also partnered with the United Way to provide a fund for folks and folks who provide direct services to families in need. And so that I think would be a good place to start, the Greater Houston Community Foundation. I also see a comment from Tanya around the hub. Do you want to read that or explain that, Zainab?
So it looks like the comment is a point of clarification about who is eligible to use the hub. And it looks like it's all essential workers. So all frontline workers under the federal definition includes grocery store workers. So I'm assuming that not just government workers, but also grocery store workers can bring their children to the hub.
And the hub is the Harris County child care support. Is that correct?
Correct.
Okay, thank you for that clarification.
Thank you, Tanya.
Nice yeah, and I think it's great that our county is opening that up to essentially all essential workers. So that's really great that it includes the private sector as well, because the grocery store workers are going to be a very large number of folks, and again, are primarily women. And so, so having that as an available resources, I think is amazing. But, looking beyond Harris County, this is a national issue, not just a local one. And so, efforts like that, it's not clear to me that efforts like that are being made around the country, which is why we really need consistent federal policies that sort of ensure that all of essential workers have access to childcare.
And it looks like it encompasses a 13-county region, according to Tanya.
Okay, that's great.
Wonderful. So our next question is about childcare workers and kind of trying to understand how we can provide some additional support to them, particularly given that they may be dealing with additional stress. So the question is about giving them access to mental health services and if there are any resources out there for childcare workers specifically.
Yeah, I'm not aware of any resources for childcare workers specifically. They do have their own professional organizations, and I've done some work with the Texas Workforce Commission, which funds a lot of childcare for low-income families, and so they've provided like professional development and support, the same type of support that teachers receive. But it's not clear to me that there are any childcare specific mental health resources available, particularly in this time. And I think there should be, because again, so we have, Philanthropy on, is participating in this webinar. I mean, I do think that there needs to be a particular focus on childcare workers, because again, they are in the exact same situation as the families that they're trying to serve, yet they're not necessarily getting a lot of additional support, mental health or otherwise.
Okay. Our next question is about disseminating information to get this message across. It looks like particularly about early childhood development and concerns around the plight of vulnerable women.
Can you repeat the question? What's the question?
Yes. The question is about information dissemination about this message. So kind of letting people know about concerns related to early childhood development or the issues that low-income women may be experiencing.
So, we published an issue brief today around the issue. I'll be speaking with NPR later today around the issue. I think that, the Baker Institute gives us a really wonderful platform to be able to, provide information and disseminate information on on what's happening, not only just now, but I mean, these issues have been happening before, but it's just exacerbated by the pandemic. And so now that we are doing what we can to try to disseminate the information and ensure that policymakers are aware of the unintentional consequences of their decisions.
And it sounds like the question was about delivering information on resources to families.
Okay, so it looks like there's several collaboratives that are located throughout Houston that I know have been trying to reach families and reach organizations with lists of resources. The Department of Family Protective Services has a website that they they have, and they've been sharing with families. I think the challenge is that often lists of resources aren't very helpful in a practical way. Like, I think from our perspective, or as from, I like to call us do-gooders, right? People who think that, we want to make a difference, we care about issues, handing someone or emailing something, now that has a bunch of numbers on it, telephone numbers. I think that sometimes families don't even have the capacity sometimes to be able to decipher which resource is the best, fit for me. Also, even thinking about now with the unemployment benefits and the Texas Workforce Commission, there's long waits. Sometimes you don't always get in contact with somebody, or you call one organization and then they say, oh, you don't meet our qualifications for our services, and so you need to call a different organization. And so while I think that providing the information is always important, it's a first step. I think the critical part that I was trying to highlight in the webinar is that it used to be schools who would do a lot of that warm handoff or warm transfer, because they would recognize something in the student, and then they would try to connect the student or family to resources more directly. And now, because we are socially isolated from one another and those social supports aren't there, that it's much more difficult to provide that type of support for families.
Thank you. I'm not seeing any more questions right now. There is a link that was provided. So findchildcarenow.org is the website for the city and county. And then Tanyelle also mentioned that the Collaborative for Children is providing technical assistance and leveraging expertise from folks like First 3 Years and others. I'm assuming this is about messaging. And yeah, I think that those are all our questions for now. All right. Well, thank you to all of you for participating in the webinar. Dr. Moore, was there anything else that you'd like to add?
Thank you all for participating. Thank you for your questions. If you have any follow-up questions or comments, you can feel free to email me at qm4@rice.edu. Thank you for all the work that all of you are doing during this time, and take care and be safe. Thank you so much.